What is hormone replacement therapy for women, and why do we do it? Hormones are the internet speed of the body, and as we age, particularly into the 40s, 50s, and beyond, we're just making less hormones, which means that our internet speed or our metabolism is going to slow down, and the body goes from an anabolic state of building and repair into more of a catabolic state of breakdown and decline because the rate of build is not keeping up with the rate of breakdown. So cells breaking down is not inherently a bad thing. Every cell has its lifespan. Metabolism is when the cells that are breaking down are being replaced by fresh new cells that help to produce skin, muscle, tendon, bone, and nerves. The point of hormone replacement therapy is to help the body maintain a healthy speed of metabolism into the middle decades and beyond. Typically starting around the late 40s to early 50s, women start to go into that perimenopausal and menopausal state. During that time, the hormones are fluctuating and they're experiencing symptoms like hot flashes, night sweats, brain fog, trouble sleeping, issues with libido, weight gain, and they just don't feel good. Even after menopause is done and a lot of those symptoms start to subside, we're still left with a low hormone state where the estrogen is low, the progesterone is low, even the testosterone can be low. The result of having low hormones is the reason why women start to age most dramatically into the 50s and 60s and beyond. Skin thickness and collagen density starts to diminish, muscle tone gets lost, bone density starts to lower, and women go into these osteopenic and osteoporotic states. And if that loss of bone density becomes significant enough, if that woman has a fall, she could break a wrist, break a hip, and that can have serious implications towards her quality of life. What if she had been maintained on hormone replacement therapy and preserved more muscle tone and bone density? Maybe, just maybe, she has a fall and has enough integrity in those tissues that she's able to withstand the force of impact and not break the bone. Now that's obviously forward thinking, but let's talk about the 40s and the 50s. It's about quality of life. In functional and integrative and wellness medicine, we use a therapy called bioidentical hormone replacement therapy. The other form of hormone replacement therapy that you might have heard of or be familiar with are the more traditional pharmaceutical synthetic derivatives like Premarin and Provera. These were the hormones that were studied in the Women's Health Initiative and found to increase breast and ovarian cancer rates. So now we have all these people freaked out about hormone replacement therapy, but the fact is we're not using those synthetic pharmaceutical hormones. We're using the bioidentical hormones of estradiol, progesterone, and believe it or not, testosterone. I personally have done extensive research on testosterone, and guess what, ladies? It's not just for the men. Women who go on testosterone experience less brain fog and sharper mental capacity, incredible libido and quality of sexual health, preserved collagen, which can have implications towards your aesthetic procedures that you're getting done into your 50s and 60s, better mood and overall affect, easier to get in shape and stay in shape because you're promoting lean muscle tone while burning fat, because testosterone helps to accelerate your metabolism. And this might be the best news of all. Women who balance their hormones throughout their 50s maintain up to 54% more collagen than women who don't start hormones. So what are your options when it comes to hormone replacement therapy? Well, here at Icon Aesthetics, we work with primarily 3 different delivery methods as to how you can get your hormones. The first option is a transdermal cream that would contain all the hormones compounded into one dispenser called a Top-A-Click. It looks a little bit like a deodorant stick. The second way is with an injectable testosterone, similar to how a lot of the men do it, as well as a progesterone capsule. The third option is a fully dissolvable pellet implant that's placed in office in your upper outer butt cheek and lasts typically 3 to 4 months, just like your Botox. In fact, I have a lot of clients who will come get their pellet and their Botox in the same appointment and come see me about 3 times a year to do that. Now, I know what you're thinking. If I start testosterone, will I start to grow a beard or turn into a man or have a deeper voice? And the answer is no, because women get dosed with testosterone about 5% of the amount that a man would get dosed at. Just enough to get your level up to where we want it, but not turn you into the Incredible Hulk. Another question I get asked a lot is, if I start hormone replacement therapy, do I have to stay on it for the rest of my life? And the answer is no, of course not. But you stay on it for as long as you want to experience the benefits of being on it. Worst case scenario, if you get on it for 6 months, 12 months, and you decide to come off, you'll just gradually return back to baseline like nothing ever happened. Granted, the baseline of having no hormones to begin with is not a great baseline to live at. Remember, this is about quality of life and preserving that quality of life for as long as we can possibly stretch it out. Now let's talk about the association of hormone replacement therapy and cancer risk. This is a very serious topic and something that comes up a lot in this conversation. So let me address it for you now. There is a widespread belief, even in mainstream medicine, that hormone therapies equate to increased risk of cancer. And that is true if you are going based on the results of the Women's Health Initiative, which, remember, was a study done on Premarin and Provera and had no bioidentical hormones and absolutely no testosterone parameter in the study. Having done my own research in an effort to provide quality and safe therapies that are effective for my clients, every study that I have come across related to testosterone and cancer, both for men and women, seems to support the idea that not only does testosterone not contribute towards cancer risk, but in many cases can actually have anti-cancer qualities. That goes for breast cancer in women, brain cancer for both genders, and prostate cancer for men. Guys, it seems like testosterone is one of the unsung heroes of the cancer fight. That being said, if you are BRCA1, BRCA2 positive, I would probably recommend you don't do hormone therapies. But if that's not you and you don't have any significant cancer history or first-generation relatives who suffer from breast or ovarian cancer, chances are you are a pretty good candidate to do hormone replacement therapy. So how does the program work? Well, we start with a set of baseline labs just to evaluate what the levels are at currently. We take a thorough medical history and we explain the benefits and the risks of doing these therapies. And again, because I am always in an effort to provide safe and effective therapies, I have done research on myself and I would encourage you to do the same. And I have concluded that hormone replacement therapy done the right way with bioidentical hormones can have massive positive impacts on your overall quality of life and keep the risks of cancer down to a minimum. Another way to think about the cancer perspective is that if you survey the general population, those who are not on any hormones at all, there's a certain percentage of them that will succumb to some type of cancer regardless of hormone therapies or not. So we know that it's not hormones themselves that cause cancer. If it was, all the teenagers and 20-somethings would be riddled with cancer because they're the ones with the most hormones. It's not just hormones that contribute to the picture. I personally believe it's other things such as sugar imbalances, type 2 diabetes, inflammation in the body that contribute to the breakdown of the cell machinery. And like I said, guys, hormones are the internet speed of the body and they help facilitate better communication between the cells. And maybe, just maybe, testosterone can be the thing that allows the cells to normalize and have their normal life cycle and break down when they're supposed to, and then get replaced by fresh new cells. So hopefully that answers a lot of questions that you have about hormone replacement therapy. I would imagine you have a lot more. We would be happy to set up a consultation with you, whether in office or virtually, discuss it further, and see if bioidentical hormone replacement therapy might be the right thing for you. We look forward to speaking with you soon.